This is Wendy Bowen, physiotherapist, once again with Know Your Body Better. We're going to continue along with the shoulder theme for a little bit. So if we've got that shoulder nice and loose, what we want to do is strengthen it up. And the rotator cuff is a muscle that's often very weak. So often I'll just test people's shoulders, get them to hold their arm up like this, push down, get them to come out here and dump their thumb down and push. That one's the supraspinatus one. Arms at the side, reaching out, push in, reaching back. I like the one hand behind the back. Lift off here, push one hand into the other. You can find where they're weak and you can target where somebody needs to be strengthened up. So a lot of times what we use are these green TheraPans. You can certainly strengthen the shoulder with dumbbells as well, but that's a whole nother video. So the chest muscle is one that tends to not really be super weak. A lot of people strengthen it with push-ups. But if you can't do push-ups, just take your band, put it behind your back, grab like this, wrist nice and straight, and you can just punch out, okay? And that will also help strengthen our serratus anterior muscles, which are really, really big at keeping the shoulder blade down against the rib cage. If you feel your shoulder blade winging out, you might need some serratus anterior strengthening. Another one is the biceps. People like to work their biceps or beach muscle. So you can just take the therapy band, step on it. You can also do this in sitting and just curl your arm up like this. That'll get the biceps. Now, if we want to look a little bit more at the rotator cuff muscles, there's a couple ways. Our external rotators are often very weak on people. The pulling in ones aren't so bad. So you can give somebody a therapy band here. They can either hold it thumb out like a hitchhiker, arms in by the side, pull the band apart and back in. Pull the band apart and back in. Now we have different color bands. We have yellow, red, green, blue. Sometimes they go up more than that. So that one's going to work the outward rotators of the shoulder. You can also take the band, open the door, tie a knot on it, throw it in the doorway, grab your band here, make it a little shorter, arm by the side and pulling out. That one I find a little easier than the double one. And then of course you switch it, turning the other way and pulling the hand towards the stomach. Now you don't see me rounding my shoulder in like that. That's wrong. That's getting our pec muscle, which is often dominant over the rotator cuff. So it's nice and slow and controlled. Usually we start people with 3 sets of 10 repetitions, but you don't want to push through pain. You just want to get to the area where it's starting to feel tired. So we've got inward, outward rotation, the biceps, the chest press. You can also take your band, just open it up like this and pull it apart. Palms down, palms up. Another great exercise, strengthening the muscles between our shoulder blades. Take your band, throw it in the door again. Okay, this one I like is just a straight pull back. And of course you can make it harder the closer you stand and you can pull back that way. And of course everybody wants to get rid of their flabby triceps and not that single muscle targeting can do it. You just throw that band up over the door, grab a hold here, keep the elbow bent by your side and pull down. And that's going to get your tricep muscles. So those are a few strengthening exercises that you can do that will help your shoulder, help stabilize your shoulder blade, plus strengthen the rotator cuff. It's Wendy Bowen, physiotherapist with Know Your Body Better. And if you want more information, please visit my website at wendybowen.com.